Welcome back to Houston Life. May is Women's Health Month, and next week is National Women's Health Week. So we want to bring attention to health issues that affect women of all ages, including pelvic floor disorders. Joining us now explaining is Dr. Solafa El-Shatanufi, a urogynecologist affiliated with Memorial Hermann, and then Preena Nair, a pelvic floor physical therapist. Welcome to you both to Houston Life.
Thank you.
Okay, so let's start with you, doctor, because as women get older, they might after childbirth start experiencing some things that they're maybe a little too embarrassed to talk about. So, it's important to share your concerns that you might have with your doctor first and foremost, right?
Absolutely.
And
it's a very common problem. We see it in 25% of the population. So very common, but it doesn't make it normal.
Okay, and so when you say it's very common, we're talking about this pelvic floor condition. Can you explain what that is?
Absolutely. So the pelvic floor is a combination of muscles, ligaments, and then all our pelvic organs. If anything is not quite working correctly, then our elimination is affected, whether it's incontinence, issues with emptying bowels, things like that.
Oh, okay. So this is why that might be, people are saying, okay, this is kind of faux pas. This is not something I want to talk about. But it's important to let your provider know because there are solutions available to them.
Absolutely. We have a lot of therapies, sometimes very conservative, like pelvic floor physical therapy, which is an excellent first line that we utilize all the time. And sometimes it's a minor procedure that can literally give you your life back.
Okay. Well, Preena, you hear the word physical therapy and you automatically think, outside of our bodies, maybe something. And the pelvic floor, as Doctor just explained, this is inside. So what does your work consist of?
So basically it's an evaluation that we do consisting of the pelvic floor. So we're actually looking at the muscles and seeing how they are working. So basically, is it tension or is it weakness? And that's what we're looking for to see what's causing some of this pelvic floor dysfunction that's going on.
Okay, I see. And women come into you and, it's probably something they're not having the most fun chatting about. But what kind of things are you seeing that are common and that you can actually help with?
So a lot of the symptoms that I do see are urinary leakage. So, like coughing and sneezing, sometimes when you're trying to get to the bathroom in time and then, barely can make it. A lot of times women also come in saying they've got some tension or probably like a feeling of fullness in the vaginal region.
Okay.
And then we've got also frequency where they're like, now I got to go to the bathroom more often than I used to, which was not something that used to happen, or even pain. So a lot of times being intimate can become a little more difficult at times too.
Yeah. Dr. E, what are some of the symptoms that you hear women having?
So common ones are leakage with coughing, sneezing, laughing, jumping, exercising, or I feel like I need to urinate all the time. Sometimes I don't make it, which can be devastating for a young woman to have to wear a pad or a diaper. And then that can happen for bowel and bladder. And then pain with intercourse, feeling sensations of prolapse or something abnormal down there. So multiple issues that can happen.
So that's initially, and that's kind of you diagnosing it, but there are things that if gone untreated that can also be affected. So what kind of things are we talking about if a pelvic floor, disorder is left untreated?
It can slowly worsen. Sometimes one issue will sort of cause the other. So overactive bladder can sometimes be caused by prolapse. Sometimes the pain will continue to progress if it's not treated because pain tends to make the muscles dysfunction worsen. And then it causes the more pain and patients go into this vicious circle that we like to get them out of as fast as possible.
Right. I think as women too, it's like we have so much other things going on. And if it's, something that's affecting you, you're like, okay, I'll just kind of put that maybe on the back burner. But Preena, there are options with physical therapy. Like what are some of the options?
So when they do come in, a lot of times what we are, after the evaluation, it's a lot of times exercises that we suggested, but it also depends on what the issue is. So whether it's strengthening or stretching, focusing on a lot of breathing and things like that. Biofeedback's a big one that we also tend to use for these issues as well.
Okay.
Yeah.
And Dr. E, you're a urogynecologist, and so that means that you are definitely in the realm to help, right?
So I take care of just female pelvic floor disorders. So my job is to diagnose the issue, and a lot of times my pelvic floor physical therapist is my go-to if that's what I think would help for the patient, and I sort of guide the therapy if that's the the route we're taking.
Okay, so you guys really are like a tag team on this.
Yes,
absolutely.
Definitely.
Okay, so they'll go see you, and then you'll refer to her and then check back with you. Is that how that works?
Yep.
Okay, well, very good. Dr. Salafa El-Shadnufi and Frina Nair, thank you so much. Now, anyone who needs more information can go online and visit memorialhermann.org/women's health, or you can just give them a call, 713-222-CARE. That's 713-222-2273.